So we're representing the primary care provider, the PCP, who is responsible for managing Margaret's chronic conditions, which include type 2 diabetes, hypertension, congestive heart failure, and she's also been experiencing declining mobility, which has been requiring increasing levels of care. So Margaret has come to see her PCP due to her worsening CHF. Upon seeing Margaret, the PCP has become concerned and determined to refer her to a cardiologist. In order to keep close management of the patient, the PCP is going to send a 360X direct messaging closed loop referral. This will enable the patient to get scheduled, but also because of the 360X protocol, the PCP will receive back notification that the referral has been accepted, and then later on, the final disposition of the referral. So the PCP is going to send back that 360X message over to the cardiologist.
So as part of the patient journey, Margaret Smith has been referred by the PCP who uses the next gen. So we receive a 360X referral on the eClinicalWorks side. So the the staff at eClinicalWorks goes to the referral screen and accepts the referral. At the same time, we can look at the external document which came in via the referral, like the CCDA and the other attachments. We can also do a TEFCA query to fetch the external document for the patient. So what it does is it establishes a connection with the QHIN network and fetches all the relevant documents. So we can see the document listed on the right side. And we also have an Elasticsearch where you can put in some keyword and it searches for the document throughout the external document. Now, during the appointment, looking at the patient history, I recommend the patient to go through the procedure, echocardiogram and the blood test. Looking at the result, the patient is identified with acute congestive heart failure, and I recommend the patient to get admitted to the hospital immediately for the further treatment. So I go ahead and send a direct secured messaging to the hospital, which sends all the CCD and the progress note details. At the same time, the set of document is available via TEFCA query on the Epic site.
So once Margaret has arrived at my hospital, I'll admit her for acute let me actually go to Epic. I'll admit her for acute CHF exacerbation. And upon admission to our hospital, it will automatically query the TEFCA framework, which will pull back the records from the other systems in the demo. Additionally, our system is automatically configured to send an ADT event notifications to members of Margaret's care team. And in this case, that would be Dr. Davis, who is using a next-gen EMR. And you'll see that message later in the demo. So speaking of TEFCA, I'll refresh this to show that this was in real time, that we did that query through the framework, and we'll get a new icon that indicates that we have external data available for that patient. So looking at the data we pulled in, you can see we got some documents from Counterpart, Point Click Care, Raintree, and eClinicalWorks. Another thing we'll notice is we received an outside message from that cardiologist that was just saw our patient from eClinicalWorks. And so you can see that message here. Back on the chart, once Margaret has been all taken care of at this hospital, I'll finish up my documentation, like writing my progress note, and then we're ready to discharge her to a Point Click Care skilled nursing facility for short-term rehab. That SNF placement will be negotiated using a 360X workflow, and that is initiated by me signing this order. So that will send the message to the SNF and see if they'll accept my patient. And when they do, my referrals team will receive a confirmation.
We're going to be following the journey of Margaret in the skilled nursing facility of Caring Hands Village. And the nursing administrator can see that the lead for Margaret came in for the referral from Epic. And then they're going to go ahead and click into Margaret, and we're going to accept the referral And then we can also see the document here as they're accepting that referral note. As they decide to go ahead and admit Margaret into the SNF, they're going to go through the admission process. And as they're admitting her, they can go ahead into that referral note and they can go in and take a look at the congestive heart failure that came over. We can also see the additional diagnoses, medications, and allergies that came over as part of that referral and the reason for referral. And we can go ahead and reconcile those sections into the chart directly, saving the nurse time and effort to get that data back into the chart without manually having to enter it. While Margaret is staying at the skilled nursing facility, her care team can also be monitoring her progress. They can see her daily updates, her vitals, and also see her readmission risk and see that it's actually trending high, and they can actually create interventions at this point with the skilled nursing facility. Margaret fortunately has recovered from her stay at the skilled nursing facility and she's ready to be discharged. As we're going to go ahead and discharge her, we can see the discharge report here and her information, and we're going to go ahead and send that over for her next care journey. So we'll go ahead and send that over. We're going to send it to Yardi, which the care team had decided she needs to go to assisted living. But before that, she's going to go back to her primary care physician for reassessment prior to the next step in her journey.
So the first thing that PCP will do is we'll send out a TEFCA or Carequality query in order to retrieve the documentation for the various stages of her previous care. And once those documents come back, we'll also be able to do reconciliation to discreetly pull data into the chart. So Margaret is still in need of continued services to ensure that she's not readmitted. So the PCP is going to order some home health services and physical therapy for Margaret. The PCP submits these orders to the home health agency and the therapist, again, via 360X direct messaging. So again, once these referrals are made, the PCP will know that they've been accepted, and then later the final disposition of those referrals. So we've seen the import of the document through Carequality or TEFCA, and then the direct message referrals going out.
So first thing we'll do is we'll notice that we got a direct message from that skilled nursing facility from PCC. As we click into that, we can actually manage that attachment. And in this scenario, we'll actually preview it just to make sure it is what we expect. Once we get into that, you'll notice that we are seeing, it is that transfer request from the Caring Hands facility. We have diagnoses. We also have some allergens added in. So, okay, we say great. And the next step is we'll actually add this to Margaret's profile. This will live in her record within Yardi and becomes reviewable later, and is also a queryable document. The next step in her transition coming back home into the assisted living setting is we're actually going to query the network to see if anybody has any additional information from Margaret's recent outing from the care setting. So we'll query the network, see who actually is available. In this case, we're going to go with NextGen. Now we're going to ask NextGen, do you have any relevant documents to Margaret? The response comes back, say yes, they do. So let's say, okay, great. What do you have? And once this loads, perfect. All right, so we do have a CDA from Margaret's recent visit with her physician. At NextGen, we'll go ahead and view that. As we scroll down, we'll notice that there's no new allergies that have been added to her profile, but she does have new medications, new diagnoses or problems. So what we'll do is actually download this CDA into her profile in EHR. And in doing so, we'll be able to add those new medications automatically, add those new diagnoses. And what this also does is now it becomes a queryable document and a further reference between Carequality and the TEFCA side of things, so that anybody else in the network that has any questions about Margaret's recent health visits is now able to pull those from the network.
And so just like everyone else, we received a referral from the PCP. And if you notice right here, I did get a notification for Margaret Smith that we did receive that referral. And to make it really easy and to include ourselves in that interoperability and to help in standardization of intake, all I need to do is review this information, which will actually recreate or create the patient's chart. No keying of the information, it automatically does that for me. So I'll just verify that Margaret's never been in my system before, and it will actually create this patient's chart. I can actually message back and forth with the PCP from here. We'll attach any documents that the physician sent, like maybe H&P, medication profiles. And after I accept the patient, we'll review any of that info that we got in case we need to verify addresses and so forth. And then once we, quote unquote, activate the patient, it creates the patient's chart in our system so that we can schedule our nurse to go out and visit that patient to assess their home health needs. We also generate an order for the physician, and because of our interoperability and that 360X connection, we'll send the physician a order through our system so that they will get a electronic version of our order and electronically sign.
So since Margaret has mobility issues, she's been referred to physical therapy. And I'm going to show you that process, how easy it is without any faxing, how you can get that referral in and go through that journey for Margaret. So here's the referral that I got from her PCP, Dr. Davis. And all of that comes in as discrete data, name, address, date of birth, all of the information. And I can also view the referral note or the CCDA here. And it came in as a 360X exchange. So that means any updates I make to that patient's record here is going to go back to Dr. Davis in NextGen. So I can reconcile allergies, medications here. I can view the transition of care document here, all of the details here. And then, so the patient care coordinator basically has all of the information needed to be able to schedule Margaret. So let's move on to the schedule. So once Margaret gets scheduled, the system is automatically able to send notifications back to Dr. Davis in NextGen that she's been scheduled, or even if the initial evaluation has been canceled or rescheduled, all of those notifications are also going to go back automatically. And let me go here. So when the provider comes in, of course, he has the information, the CCD is the referral documents that he can open up here and see that. Let me double click that. Okay, you saw that already. And then if he wants additional information about the other episodes of care, he can do that as well with this quick search. So I'm gonna do this quick search here. And it's going to take a couple of seconds. And again, I don't have to fill in any information. It's just a single click search there, which shows all the episodes of care that Margaret has gone through recently. And you can see the NextGen document here. I can also see the Epic hospital stay documentation here. I'm going to click on that to preview. And that has additional details about her episode of care at Epic. And so this is querying Carequality and TEFCA. So you're getting all of this information. You also have the option to quickly import any of the documents you select by using the import button here. And when the doctors or when the therapist is done with the visit, they can go ahead and send the plan of care back to Dr. Davis in NextGen. And that's also automated, where when they sign off on the note, it gets to NextGen automatically via direct message. And they're able to sign electronically. And it comes right back into Raintree. And you can see the signed plan of care when this loads. Okay, we'll give it a second. But the whole process that you see, again, what you didn't hear me say was faxing and phone calls. You don't have to do any of that. It all comes in automatically, and you're able to send notifications back to the primary care provider. Other organizations are also able to search via Carequality and TEFCA for Margaret Smith's documents here.
So the first thing we're going to do is we're going to show some of these orders that were sent over via direct message. So they're sent over electronically. We're able to electronically sign them, and then they go back, and then the care can be delivered as ordered. But that's not the end of the story, because Margaret's been complaining to a nurse on call at the assisted living facility that her gums are bleeding when brushed with, and she's having increased sensitivity. And this has been worsening over the last several weeks. So the assisted living facility has contacted the PCP, who after examination has determined that Margaret may have periodontal disease due to her type 2 diabetes. So the PCP is going to submit yet another direct message, this time to an endodontist. And the referral will be able to provide all the relevant clinical context, including her diabetes diagnosis, current HbA1c levels, active medications, and the PCP's clinical rationale for the referral. And this is particularly important that we're able to do this. EMRs and EDRs, you know, it's almost like they're two different kinds of medicine. However, using direct messaging, we're able to bridge that gap and send the information over to Dr. Dane.
We've now received the referral electronically. It would flow into the EDR so that they would take all the information that's provided from the next-gen EHR, all those additional meds, allergies, everything that the physician had noted would be brought right into the EDR in dentistry. So now that's a whole new care setting that we're highlighting here as part of her journey. The exam is scheduled. The endodontist determines that yes, indeed, there was chronic issues that she's had. And so with those periodontal issues, they're going to provide a care plan, some maintenance, and they're going to schedule her for root planing. And so with all of that going on, they need to document all that in the treatment plan, and they're going to take that document and via direct messaging, they're now able to release it out of their EDR and send it back to not only the PCP using NextGen, but to the assisted living facility where Margaret lives, so they can go into Yardi and be able to be consumed again as part of her journey. Now, the beautiful part about this is we followed Margaret through this clinical journey. We've got to see all the different care settings, all the different providers, and they're doing all of this electronically in real time without having to, again, use faxing. We know all of the issues with faxing. We're quite surprised that in healthcare that it is 2026 and we're still using fax, right? So all of this demonstrates what is possible, and all we need to do is just make it happen. What we'll do now, though, is that Margaret's journey through the clinical side is concluded, but that's not the end of the data.
Fasten's an interoperability platform that makes it easy for patients to share their medical records with organizations and apps that they trust. We connect to 52,000 institutions across the US via direct patient access API integrations, and we were one of the first organizations to connect to TEFCA under individual access services. So, throughout Margaret's healthcare journey, she can stay updated using a personal health record app of her choosing. In this case, we're going to use Augie, which is a Fasten customer. Margaret would have opened up her application, signed into it, and decided to connect her healthcare providers. In Augie, you see Fasten is integrated as part of an SDK. Margaret will be prompted to enter in her email address. Next, we're going to pass Margaret off to one of our identity verification providers, either Clear or ID.me. Clear is going to require that Margaret enters her phone number. And then she's going to verify her ownership of that phone number by entering a 6-digit code, which we're going to skip at this point. Next, Clear is going to prompt Margaret to take a photo of her face and a copy of her government issue ID, a passport or a driver's license. Again, we're going to skip that because I look nothing like Margaret. Okay, so at this point, Clear is going to match Margaret's photo against her driver's license or passport and match that information against the DMV, the passport office, and the government agencies that they're connected to. This part takes about 15 seconds, but when it's complete, Clear is going to send Fasten an electronic key that will allow us to unlock the TEFCA network on behalf of Margaret. So you can see here all of Margaret's demographics were sent to Fasten. We're now able to query the TEFCA network and get a list of all the institutions that have previously treated Margaret. And you can see some of the participants here. So we're going to select a couple of these, and then we're going to let Margaret share those records with her app. So let's take a couple of moments. But once that's complete, Augie will have received all of Margaret's medical data from the network, including lab results in FHIR format, as well as claims information, which might take another moment or two. But what you've seen here is that Margaret was able to pull all of her medical data from the network without searching for any healthcare institutions by name, without logging into any patient portals. This was all happening directly via a verified identity using Clear or ID.me through Fasten's connection to Kno2 and the TEFCA network.
Margaret here is one of our patients, one of our members. In Georgia, she has Clover Insurance. And so all of these wonderful clinicians, in addition to all the documentation that they're sharing, will ultimately then bill us as the payer. And so we'll have all of that claims data. And now, with Kno2, we're the first payer live on the Kno2 network, we'll be responding back with all of that data to individual access requests under TEFCA so that patients can get their own claims data, their own clinical data all connected.